Ribavirin for chronic hepatitis E virus infection. My name is Kai Jimenez. Definition: hepatitis E virus is one of the most common causes of enteric hepatitis worldwide. It often presents asymptomatically or with symptoms of acute hepatitis that resolve spontaneously. Chronic hepatitis has been described in immunocompromised patients and could explain some cases of idiopathic chronic liver disease. The most effective treatment is remain unknown.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you liked this video. Absolutely make sure to check out the course.
Applications in medicine. Ribavirin is considered the standard treatment of chronic hepatitis E virus in solid organ recipients, and it is also highly effective with initiate and acute phase in patients with hematological malignancies.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching.
Pros and cons. Ribavirin co-administration with ibrutinib is safe, but the dose could be potentially constrained by pre-existing anemia. However, prolonged treatment may be required due to a potential poor response of hepatitis E virus to ribavirin in the first month of ibrutinib therapy. as we discovered in our series.
So today I'm bringing you the alphabet of hepatitis. Sorry if you're expecting something else. The thing is that there's Hep A, B, C, D, E, and some of them are sexually transmitted. So it's important to differentiate what each hepatitis is. Now let's start with what is hepatitis. Hepatitis is an inflammation of the liver caused by a viral infection. These 5 types of hepatitis are a big deal because of the amount of illnesses, epidemics, and death that they cause. Now, the symptoms of hepatitis are relatively similar. Fever, nausea, vomiting, joint pain, jaundice, loss of appetite, and more. So without further ado, here is my handy-dandy study guide of all things hepatitis. Never thought I'd be making one of those. Hepatitis A. The major way of transmission is through contaminated food and water. In fact, Hep A is primarily associated with dirty water and poor sanitation. Symptoms generally take about 2 to 3 weeks to show up. However, it's rarely fatal and there is a Hep A vaccine. Hep B. Unlike A, it is not spread through contaminated food or water. It's actually spread through infected blood, sexual contact, or needles, and symptoms take on average about 2.5 months to show up. In fact, the virus can survive outside the body for at least 7 days and still cause infection to a new person. If left untreated, Hep B can cause liver cancer and serious damage. Good news though, there is Hep B vaccine. Also, 90% of the people infected usually recover within 6 months. C. C is spread primarily through coming into contact with infected blood transfusion, sharing needles, and being born to a Hep C mother. Symptoms can take anywhere between 2 to 6 months to show up, and 80% of cases don't even have symptoms. However, there are antiviral drugs to take care of this. Unfortunately, no vaccine. Hep D. Well, to get you to D, you must already have Hep B. Therefore, it is spread from sexual contact or blood. No vaccine or treatment is available, so prevention is essential. E. Again, E is primarily through water and contaminated food. Symptoms take about 40 days to show up. Unlike A, there is no vaccine, though it's not fatal. Remember, prevention is always better than treatment, so be careful of the sanitation around the food and water you drink. So that was all things hepatitis from A to E. See what I did there?
Issue applied in Ecuador. Ecuador is not an endemic country for hepatitis, as is the case with Peru and Brazil. However, even though the national rate is less than 8%, it is believed that there could be people who suffer from hepatitis, but they have never been diagnosed due to not having subtimely medical attention.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days. Liver enzyme elevation, as shown in blue and labeled ALT for alanine aminotransferase, usually occurs 4 to 5 weeks after exposure to HEV and persists for 3 to 13 weeks. Symptoms noted by the purple bar occur when liver enzymes are elevated. Virus excretion in stool, illustrated by the orange bar, is variable, but usually lasts from about 1 week before symptoms appear until about 1 week after they have surfaced. However, this time frame can be longer in some people. Viremia in acute self-limited infections, shown by the green bar, can be detected about 3 weeks following exposure or a week or so prior to onset of symptoms, and last for about 2 weeks. Antibodies to HEV, both IgM anti-HEV, depicted by the pink hatched line, and IgG anti-HEV, illustrated by the black hatched line, are usually positive about 3 to 4 weeks after exposure. IgG anti-HEV persists, but IgM anti-HEV declines rapidly during early convalescence and is usually negative by 13 weeks. HEV serologic testing in persons with acute hepatitis, for which other causes have been ruled out, may be performed, especially in someone who has recently traveled to an area where HEV infection is more common. Chronic HEV infection is rare, but has been increasingly recognized in immune-compromised patients. Immunoassays to detect anti-HEV are commercially available, but are not FDA approved. Nucleic acid tests for the detection of HEV RNA are performed in research labs, but are not commercially available. This segment is now complete.
Conclusion. Effect of various immunosuppressant medications of replication of hepatitis E virus needs to be studied in vitro. It is reasonable to start Ribavirin treatment for chronic hepatitis E virus to prevent the progression of liver disease and cirrhosis. It is reported to decrease sensitivity to Ribavirin in tissue culture experiment yet. Further studies to investigate the emergences of minor variants during Ribavirin treatment, as well as their predictive capabilities in regard to treatment failure before administration are needed.
Our lab studies hepatitis B and E viruses, which cause about 300 million infections worldwide and kill almost 1 million people annually. Neither one has a cure. We have developed new screening systems to identify new drugs to cure these viruses. Both hepatitis B and E viruses affect the liver, but they are very different viruses. Hepatitis B virus is transmitted through the blood and other bodily fluids. It enters liver cells where it hides in the nucleus. We try to find drugs that can kill this virus without causing harm to the patient. Hepatitis E virus infects people through contaminated pork meat and water and stays within the cell body. We try to find molecules that can stop the virus from making copies of its genome. Our screening systems are faster and safer than existing platforms. Our systems are high throughput, meaning that we can screen millions of compounds within a short period of time. We modified both viruses so they are safe and robust for screening. The screening system closely mimics the situation in patients with chronic hepatitis infections. With these screens, we hope to provide cures for viruses that cause serious global health problems.
Thank you very much.